Alright guys, let's take a look at our patient's symptoms here. We got orbital sphingolipid biosynthesis regulator 3, endometritis, and acute bronchitis. What do you think, Doc Leslie?
Based on these symptoms, I would say it could be.
Hey, hold your horses. Let me finish, please. Now, Randall, what do you got for us?
Well, from my understanding of the patient's condition, it seems like...
Wait a minute, Hawks. I think we're overlooking something here.
What are you suggesting, Hannah? I'm not just pulling this out of thin air. It's hemimegalencephaly, all right?
I see your point, Dr. Hawks, but
Oh, shh. Up, Leslie. This isn't up for debate anymore. As much as it pains me to say this, you're going to have to perform a hypophycectomy on our patient.
Dr. Hawks, that's highly risky and...
You don't get it, do you? Risky or not, it's the right treatment. Now, Randall and Hannah, you two are going to break into that patient's residence, find any clues about their illness.
All right, sure thing, Hawks. We'll be on our way.
I have been a neurosurgeon for over 20 years, Tracy. I think you're doubting my expertise.
You may have been a surgeon for a long time, Hawks, but that doesn't mean your past decisions were infallible. Your track record shows otherwise.
And what exactly am I wrong about? You think this isn't the right procedure for my patients?
The same way you thought the last 3 procedures you've performed were correct. Each time we had to reverse those surgeries. How can I trust your judgment now when it failed us in the past?
Do we want to forget that Frank is a surgeon now and it's probably his fault those happened?
Frank has been gone for months now and you're still bringing him up.
Well, at least he's not disobeying orders on my team anymore.
Like Randall and Hannah?
I didn't tell them to break into a patient's home.
Yes, you did. What exactly did you intend for them to accomplish breaking into a goddamn orphanage?
Well, that's a new one. The patient is child-sized, but they have some unusual conditions for a kid. Hopefully Hannah and Randall are having better luck at the orphanage.
You incompetent idiots! How could you make such a grave mistake? Hemimegalencephaly is not something to take lightly.
We were trying our best, Dr. Hawks. We thought we had the right diagnosis.
And we did at first. The symptoms matched up with the patient's condition.
How the hell would you know, Hannah? You and Randall once again accomplished literally nothing.
More like you accomplished nothing. We told you Tracy would veto the idea.
She wouldn't have vetoed it if you clowns didn't rat yourselves out to her.
Wait, so once again, I'm the only one treating the patient. What did you two do while I actually worked my ass off to help the patient?
You call getting the patient in critical condition based on Hawks's junk science helpful. Good Lord, lady. I'd hate to see what you think is useful dropping a dollar bill in one of those wishing fountains in front of a Chinese buffet.
Oh, you are so dead, Hannah. Fuck you.
Oh, God, you people are so obnoxious. Leslie, shut up. Randall and Hannah, also shut up. All of you are terrible at your jobs.
You demanded us to break into an orphanage for someone you mistook as a child. Maybe we're not useless.
I'm gonna go do something not useless like getting lunch. Screw all of you.
Did you really demand your doctors to break into an orphanage due to the patient's height?
Don't tell me you wouldn't have tried the same thing anytime someone in their 40s says they have leukemia, and they also aren't tall enough to ride roller coasters.
I legitimately wouldn't. Leukemia isn't contagious.
But it is abundant, is it not? It may just as well be. Checkmate, stupid oncologist.
I don't know why you think that's a W, Hawks.
Stick that W up your elephant ass. I've got a patient to treat. Hawk storms into the operating theater without protective gear and slips on bodily fluids. You're creating an unsafe work environment by letting that happen.
We know how to do our jobs, Hawks. We have been doing them for years.
Hemimegalencephaly was the correct diagnosis, and we were treating it correctly too.
And then you come in here unprepared and throw around a new diagnosis like it's nothing.
You need to stick with what you're doing, Hawks. We have protocols for a reason. You can't just go off on your own and make up diagnoses at will.
I was right about hemimegalencephaly being wrong. I solved the case of tropical disease during lunch with Dr. Johnson.
You were mistaken, Hawks. We know what we're doing.
So you just want to ignore all our hard work and throw away our knowledge?
You don't understand. I was right. And we need to get back to basics and start doing our jobs the way they were supposed to be done.
Like learning to wear protective gear and keep yourself and the patient safe while storming in here after a lunchtime epiphany. That'll be the day.
Look, I get that you're mad at me for the mistake I made with the diagnosis. But if you would have just listened to my team in the first place, we wouldn't be in this mess right now.
That's not true, Hawks. You were wrong about hemimegalencephaly and the team followed your lead. The mistake was yours alone.
And I'm telling you, if they would just listen to us once in a while.
You called out a diagnosis of a patient whose chart you didn't even fucking read, so you came up with the ridiculous idea of having your doctors break into an orphanage. There are plenty of sick children in regular homes, too.
I thought you would have rejected that idea.
I would have.
Then I don't see what the issue here is.
Your patient is in their late 40s, and you made a really dumb assumption. Do you visit a lot of buffets and ask people when they're expecting?
That sounds like something you would do, but instead at a fertility clinic and you'd ask them when they're getting lunch.
That is not the uno reverse card you think it is, idiot. Literally go away.